Welcome everyone to Don't Let Vendor Solutions Lead to Compliance Problems. Thank you all so much for joining us. Kelly will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'd like to introduce our speakers for today's call. Joining us today are Roger Abramson, Vice President and Counsel of Benefits Compliance at NFP, and Chase Cannon, Senior Vice President and Counsel and Deputy Chief Compliance Officer of Benefits Compliance at NFP. Chase, the floor is yours.
Thank you so much, Amber, and thank you so much, everybody, for joining today. We're always excited to have you as our guests on our webinars, and we are excited to cover compliance topics that may be impacting you with your benefit plans that you're sponsoring for your employees. And feels like we never have a dull moment in the compliance world. We're always coming across new issues and new challenges, either from outside vendors, which is what we're going to talk about today, or through new or updated legislation or regulation. And so we'll talk about all of that today. But Roger, it's great to have you on the call too. And we'll be passing the mic back and forth between Roger and I to cover some of these topics. But our topic today is all about vendor solutions and the compliance challenges those bring. And we'll talk about what a vendor solution is. These are also referred to as point solution programs, or benefit snap-ons, as I've heard them referred to before, but basically anything that is sort of acting as an additional benefit, kind of a snap-on part to your regular medical, your major medical plan. And so all sorts of vendors out there, and most of these products are really, really helpful in bringing additional services and benefits to your employees. And in no way are we trying to diminish that. We just want to address the compliance challenges that often get forgotten when we snap on benefits like this to our major medical plan. So as a quick introduction, this is me. I'm Chase Cannon. You can see Roger's picture here as well. Roger is in a little bit more high definition than myself. Both of us have ties on, which is generally how we don't show up to work, but we like to show up on our presentations pretending that we wear ties all the time, and we are both professional in that way. So great to have Roger with me today, and now you can have a face to go with a voice. And our standard disclaimer here is that this presentation is intended to be used for general guidance purposes only. It's not intended to constitute tax or legal advice. Any question of application of the law should be addressed to legal or tax counsel. And the information we're sharing is current as of today, February 21st, 2024. So with that, we'll have a look at our agenda. We're going to go over what we mean when we're talking about vendor point solutions. We'll talk about the laws that could come into play there, your standard federal laws. That's what our focus will be on today. We'll talk about some practical solutions when it comes to the application of these laws. And then we'll get into some practicalities of how these point solution programs can impact HSA eligibility. What are the tax implications relating to these point solution programs? And then if there are any reporting requirements, what are those? How do they come into play? What do you do to be able to tackle those? We have some takeaways at the end. So we'll have a takeaway slide towards the end of the presentation to help recap this, because there is a lot of information. And of course, we'll be sharing the slides afterwards. So please do submit your questions if you have them. Our whole team is behind Roger and myself answering questions. So if you have those questions, submit them. We'll get them answered. We may even be able to address some of those on the webinar itself. Hopefully, we'll answer a lot of those questions with our information today. So as far as an overview of vendor point solutions, what are we talking about? And generally speaking, point solution programs are specific vendor solutions that add value, and I would add the word benefit to an employer's major medical plan. These are a recent and popular trend in the employee benefit offering space, and we really have seen an increase in the number of vendors and the types of benefits being offered through these point solution programs really kind of explode over the last, I would say, 2 to 3, maybe 4 years. So these benefit plan enhancements, that's another word we hear for them sometimes, range from specific condition management, and we'll have some examples here on the next slide, but specific condition management to digital solutions and applications to overall benefit program simplification. So talking about broad down to the specific here, generally these come through third-party vendors. And we won't be naming any of those vendors today. We don't want to call that out, but we generally, these are not the carriers that are bringing these solutions. These are coming from outside third-party independent vendors. The premium generally is paid by the employer. That's how we've seen this set up most commonly. We'll talk about what that means for the tax aspects and the, what that does to the plan itself as an employer-sponsored plan here in a minute. But generally, the employer is picking up the tab on the premium itself. That said, and as we'll talk about here in a second, and which is very important, because most of these benefits are considered medical care or medical benefits, they actually could be paid pre-tax by the employee through the Section 125 plan. And so that comes back to, again, whether these offerings, these point solutions are considered medical care under the Section 125. That's the section of the Internal Revenue Code that allows premiums to be paid pre-tax by the employee through salary reduction. We sometimes call that the cafeteria plan. Section 125 plans, those are the same thing. So, but generally, the way that we see these set up is the employer is paying the whole premium. There's another definition on the right-hand side here. Is a point solution is a specific service for a specific condition, usually a chronic condition, to fill a gap in the healthcare system, and that would be the sort of the employer's healthcare system, right? The system that the employees are getting their benefits through. So you see some examples here on this slide with diabetes, behavioral health, care navigation, disease management, and then MSK. We always have the funnest acronyms in the benefits world, and MSK is one that's been introduced to us over the last 1.5 years, 2 years. That is musculoskeletal. And so we even have a nice picture here of the musculoskeletal system of the upper body. But here is a list of other types of point solution benefits. And again, these come in all shapes and sizes and address many different health conditions and concerns. These are the most common, though. We see musculoskeletal. That is a mouthful, by the way. If you're on mute, you might want to try and say that one yourself. See if you can do it better than me. But fertility benefits is another common benefit through these vendor point solutions. Developmental disability, weight management programs, and then the ever increasing, thankfully, mental and behavioral health. We see that, and I say thankfully just because we have such a need in our country and across our employee bases to make sure that our employees are taken care of with their mental and behavioral health challenges, the same they would with their physical, medical, surgical. And we see that in mental health parity. We have covered that on past webinars. We know there are big compliance challenges there, but we just see an increase in the last 5 to 6 years of the awareness of the importance of mental and behavioral health services for everyone in our country, but particularly through our employer-provided group health plans. And so this is one way that employers are bringing that service and that coverage to their employees is through these vendor point solutions. But we just want to really highlight the importance of that, and also a reminder when we start getting into the group health plan space and mental health benefits that we also think about the mental health parity rules. So now that we have kind of a pretty good idea of what we're talking about with vendor point solution programs, this slide outlines several of the compliance considerations. We will hit on these ones today. We would say these are the primary ones, but we have to think about ERISA, whether ERISA applies. That's the law that requires a written plan document, an SPD or summary plan description that is distributed to participants, your Form 5500, and not to be forgotten, your fiduciary obligation. Fiduciary is that fancy word that we use in the legal world and in the benefits world to describe your heightened responsibility because you are sponsoring the group health plan for your employees. And so that's ERISA. COBRA is obviously the continuation of benefits. The ACA is all of those protections that we've gotten used to over the last 14 years now, with your various reporting obligations and coverage requirements, and the idea that you need to integrate most other Snap-on benefits, including HRAs, need to be integrated with the group health plan. That's an ACA rule that we will deal with. Taxation is a big part of this. How do we handle the tax? What happens with the HSAs if you're enrolled in one of these programs? Does that conflict if you are also sponsoring a high deductible health plan and allowing employees to make a pre-tax contribution to their HSA or a post-tax contribution to their HSA, and maybe you as the employer are also contributing to that HSA? And then we have some other general considerations in purple with the mitigation of risk, member communication, just that general idea of making sure employees actually know what they have. And then stop loss is another challenge. How does this all play with the stop loss carrier? If you're in the self-insured space, that's always a thing to think about, no matter what you're talking about. In various situations, you may have network agreement limitations that need to be looked at. And so that's another challenge, probably a little bit less primary there. So those are some of the compliance considerations there. There's some common themes that we're going to be talking about here. And I put up this party theme because in my house, we have two birthday parties in the last 2 weeks for my kids. And so we've been thinking a lot about themes around here. And if any of you did not get to enjoy your weekend last weekend, we got to have 29-year-old girls at our house doing a Taylor Swift party. So a Taylor Swift themed birthday party. And then this weekend, we're doing a soccer themed birthday party. So we love the themes. And thankfully, we'll be moving through that after this week, and we don't have to do any themed parties. But as we're thinking about themes in today's presentation with respect to vendor point solutions, one common theme is eligibility. And that's just the thought of, are you going to make all employees eligible for these point solution programs? Or is it only going to be those that are eligible and participating in the medical plan? We'll see why that matters here in just a second. But that's one theme, just eligibility. Who are you going to make eligible? Because most point solution benefits are considered medical care, you're going to see this common theme of integration with the medical plan and how that's a key to achieving compliance when it comes to these point solution programs. The other thing here that's a common theme is that the vendors generally don't consider their solution as an insured product. And this is a challenge because if ERISA applies, you have to file a Form 5500 and you're going to have to include information regarding this plan. And if it is insured, you're going to have this Schedule A. And so a lot of these vendors, because they're not considering this medical care or subject to ERISA, there may not be a Schedule A coming like you would with your general insured products. And so that's a kind of a mismatch and a common theme that we've seen as we've worked with vendors. So we'll talk about some solutions there. And then also you may need to, a common theme with all of these is that you may need to work with outside counsel to get a really good answer and direction on where you're going here. So with that, now that we've introduced the party, we have some common themes with point solution programs from the compliance perspective. Let's talk a little bit about these laws. And we just put the 4 major federal laws here. We're going to talk about a few others as we go throughout, but ERISA, COBRA, HIPAA, that's the law that protects our personal health information from being disclosed all over the place when we are participating in our own company's group health plans, but plenty of obligations on you as the employer as you sponsor that group health plan, and then the ACA. Thankfully, for all of these laws, it really comes back to whether the benefits being provided under the plan constitute medical care. And medical care is defined on this slide here. I'm just going to read it because it really does help to just hear these words and hear how broad these words are. But at a high level, for purposes of these laws, medical care is broadly defined to include amounts paid for the bolded terms here: diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purpose of affecting any structure or function of the body. And so that's really the definition. You can see how broad that is. If there's any diagnosis is a medical professional sort of telling an individual human being whether or not they have some type of medical condition. Cure, mitigation, or treatment, that would all be, giving advice on how to deal with that particular condition that this individual human being has. Prevention can get to, just advice about how to stay away from that disease. And then you have this really broad language of for the purpose of affecting any structure or function of the body. So really this helps us default into the mindset that most benefits provided are going to constitute medical care unless there's some type of exception, or unless it's very specifically designed to not be medical care. We'll look at some examples here in a section, but the idea here is that if you have medical care, you now have the application of all of these federal laws: ERISA, COBRA, HIPAA, and the ACA to start, and then we'll talk about the HSA, the tax rules as well. But as soon as you have medical care, you have to think about how you're going to comply with these laws, and you are usually already complying with these laws with the group health plan, but now you've got to figure out how to do that with the point solution programs. So what is medical care with some other considerations? This is a licensed physician providing a diagnosis, a treatment, or a prescription for an employee's specific medical condition. Think about whether that individual physician or therapist is a trained and licensed medical professional. That's a factor to consider. Whether the physician or therapist is actually making a diagnosis or just responding to someone who has self-diagnosed, and whether the advice direction offered through the program is specific or individualized to the employee, and compare that with the advice or direction is broadly related to the general condition the employee is seeking to address, and then whether there is any specific direction or prescription specific to the individual employee. So similar 3 and 4 there, but just getting to that idea is whether this is individualized, customized for the employee, or is this general information. So let's look at some quick examples here to help explain this before we talk about how we comply with these laws. But this is really just trying to figure out whether the program itself is subject to these laws. Example 1 is you have a program which is accessed through a mobile phone app, and that program asks John to verify whether he has a specific condition, and we'll use type 2 diabetes as the example here. And John verifies that indeed he does have type 2 diabetes. As a response to John's affirmation that he has diabetes, the program gives John general coaching services about diet, exercise, and sleep habits that will be beneficial to reducing the risk of progression of type 2 diabetes. This type of benefit here would constitute general coaching, and that is not generally enough to be considered medical care. So you can see John kind of self-diagnosed or self-certified. There wasn't a physician there telling John that he was, that John was type 2 diabetes, has type 2 diabetes. And then the information coming back in response is general information. Compare that with example 2 here, where you have the same facts, except that after reviewing John's eating habits, there's a physician or a therapist, again, think trained, licensed medical professional there, that's providing specific advice. such as you should consume less soda, eat less sugar, eat more greens, and take a particular prescription drug. That type of specific advice would be a treatment or prescription for John's particular condition, and therefore it constitutes medical care. That means this program here in example 2 would be subject to ERISA, COBRA, HIPAA, and the ACA. Let's look at one more example here, totally separate from that first example. This program vendor sends a kit to the employee's home to collect a blood sample via finger prick. The sample is then sent to a lab where it's tested for food and other allergies and sensitivities. The employee receives the results via regular mail or email and is given specific recommendations based on those results. Again, this is a different structure, right? This is sending your blood sample through the mail, but this type of individualized diagnosis and treatment would generally be enough to be considered medical care. Again, that means ERISA, COBRA, HIPAA, ACA all apply. So again, most of these point solution programs by design really are meant to address specific diseases, and those diseases require and the programs themselves really have as part of them an individualized diagnosis, treatment, or prescription services, and that's going to be medical care. That's why we're really just trying to say, well, not every program is going to be considered medical care. That should really be the mindset as you're going into this. It becomes difficult to argue that a lot of these point solution programs are not within the purview of ERISA, COBRA, HIPAA, and the ACA. So that's kind of where we've landed on most of these. Again, we'd have to look at the facts of each, and we have done this with a lot of the specific vendors, at least from our clients that we work through this with. But that and our conclusion has usually been that these are medical care. We gotta figure out how to solve for ERISA, COBRA, HIPAA, ACA compliance. So that's our conclusion, whether federal law applies, and that's the analysis that you would have to go through with each of these programs. And so with that, I'm going to flip it over to Roger, who is going to walk us. I've sort of set the table and created the problem. Roger is a much more friendly guy, and he's going to figure out and tell you what are the practical solutions for the application of these laws. So Roger?
Yes, thank you. Thank you, Chase, for that. Yeah, so we got a kind of overview from Chase, a detailed overview of the main laws that will apply. And then now we're to the question of, well, okay, now how are we supposed to deal with that? And the theme you're going to hear, you've already heard a little bit of it already from Chase, but you'll hear it over and over again, is integration, integrating the point solution into an already existing plan. I do want to reiterate something Chase said at the opening, which I think is important. These things, as a general rule, these point solutions, these snap-ons or extra benefits or so forth, are generally great. It's not, we're not here to rain on everyone's parade or anything, and it can be a little frustrating. I can see on the end of an employer, it's like, hey, we got this it's a niche benefit. It'll help a lot of my folks, and we can offer it along everything else. And here comes some compliance folks telling us we have to do all these little things. These are just little programs, you know. Why do we have to make such a big thing about it? We're just trying to help our employees. You absolutely are, and we're here as part of our deal to kind of help make that even easier. And again, it's about integration. We always talk about benefit plans in our world, and we kind of know what those are, of course, but it's not really an intangible thing, right? It's if someone to say, hey, show us your plan. You might show them plan documents or materials and so forth, and that's an important part of the plan. But it explains how the plan works, how it operates, what it does, what it offers. But a plan itself in our world, an HR world and compliance world, it's an intangible thing. It's just an entity. So to explain integration, I think it might be useful for just a minute if you'll kind of indulge me for just a second in terms of indulging, excuse me, in integrating into a plan. Let's talk about something everybody understands, whether you fly a lot or a little or some or none. We all pretty much know how, an airport works, right? An airport, a typical airport near a typical city, just think of the one, near you or the one you often use. What do airports do? They serve a designated purpose, air travel options for folks flying in and out. for a particular population, people who have a need. They need to travel in and out by air travel. They go to the airport. And airports are subject to a lot of federal laws and compliance issues, FAA, TSA, and all that kind of stuff. So just imagine typical airport, and they have the usual major carriers that we're all familiar with. And one day, a little startup, little niche airline shows up, and they said, hey, we just started up. We have a niche market, and we know that there are folks in this city, in this area, who want direct flights to smaller little cities in our region or something. And maybe the major carriers fly there or they don't, but if they do, it's not with direct flights and so forth. And this looks like something that would be a great service to a segment of the population. And if the airport thinks that's a pretty good idea, what do? They announce to the area, we have a new carrier. It's a smaller little carrier, and they have going to serve our airport. They give them a couple of gates, and they join that airport, that already existing place, alongside all the major carriers, and service that entire market. What you would never hear is somebody in the airport authority going, hey, we got this small little great little airline, it's regional, it's niche, and we're going to build an entirely new airport just for them. That would make no sense. You already have the airport, you have the infrastructure, the security infrastructure, the runways, and all of the other things, and that's where everybody goes to fly. It's all in one place. So before I torture that analogy too much further, I hope we're understanding kind of where we're going with it. As I said, a plan's kind of intangible. So when we talk about integrating, I'm sure you picked up on this, that little regional airline is kind of like a point solution. So the best practice here is integration of the point solution program into the already existing plan. You see these little graphics here. It doesn't have to look like that. That's an example. There's a myriad ways it can be done, but it's just to illustrate taking the point solution that sort of sits on the outside and bringing it home into the plan, preferably alongside or with the major medical plan, or as a component of the WRAP plan, or with other already existing plans. But with that analogy, we're not going to build an entirely different airport just for this small but very useful benefit. We're going to bring it in the fold and treat it like everything else. So we'll go to the next slide. We'll talk about some specific applications. For ERISA is for health group plans. One big thing to do is limit that point solution program participation only to those enrolled in the employer plan. Add that program to plan docs and wraps, SPDs, the materials that we talked about earlier, and then add point solution benefits, whatever the benefits are, that program to the Form 5500 reporting. Again, we're going to add it to the plan. So we don't have to have a Form 5500 for the existing plan and a separate one for this point solution. Make it part of what already exists, the infrastructure that's already there. COBRA. One thing to go about is limit that program participation only to those, again, enrolled in the employer plan. Include the program as part of the COBRA package. We had a question earlier, I believe I saw, asking about I believe whether mental health benefit, a point solution in that regard, would be subject to COBRA. The answer is most likely yes. It would be a group health plan. Chase addressed that a little bit earlier, and that would be something that will be part of a COBRA offering. But if you bring it as part of the major medical plan, integrate it into the plan, that's one offering of COBRA. You don't have to offer COBRA for the major medical plan or whatever, and a separate one necessarily with that extra benefit in most cases. Now, COBRA presents a few challenges, so I'm speaking generally, but you work with your vendor regarding post-employment participation rules. Some of these vendors, as Chase mentions, they're offering a great service. They mean well, they do their thing, but sometimes they're like, well, wait a minute, well, this is just for, employees, right? This isn't, COBRA doesn't apply to this. It will most likely if the rules that we talked about, excuse me, earlier would apply here. So you'll have to work with that program vendor so they know. If you have a COBRA administrator, make sure to work with them to include that point program in COBRA election packets and notices. Again, if you have a group health plan, and odds are you very much do without these point solution programs, then you already have a COBRA system. Attach, put this part of the plan, integrate it into it, and become part of that administration. Now, there are a few challenges, as you can see. This one's always popular. Determining rates for the point solutions, that can be a little challenging. It's as a general rule, the premium is cost of coverage. That's fairly simple to do with traditional insurance, but a little challenging sometimes with point solutions like these, or things that operate a little differently. A few COBRA vendors cannot or won't, for whatever reason, administer COBRA for their point solution programs. Perhaps they don't integrate, so to speak, with their own systems and so forth. But some also do. But if you can't find one that does, or yours doesn't, you may have to handle some of this in-house. But if it's integrated as part of the overall plan, that still makes it much easier to do. On the next slide, we're going to talk about HIPAA and the ACA. Chase has mentioned HIPAA. We're generally familiar with the myriad privacy and security rules and obligations that apply with health plans. Assuming you already have that, again, that infrastructure there for the health plans that are already extant in your plan, again, attaching this point solution to that and not letting it be out by itself will make it a lot easier in terms of compliance. You already have most of those policies. You can massage them and adjust them for the particularities of this point solution as needed. But again, bringing it into the fold, bringing it into the same infrastructure that you already have with the plan. The ACA, Chase mentioned some of the issues there. Again, integrating that program with the employer's major medical plan, which is already, or should be, ACA compliant. That brings it into the fold as well. And that integration will yield the ACA compliance by virtue of that medical plan compliance. If it's sitting out by itself, that's not the case. Bring it in to the already compliant plan universe. And that integration, again, is achieved by adding, excuse me, the point solution program to plan docs, wrap documents, SPDs, etc. There's also the considerations, a little additional, the mental health parity law, MAPIA. A real detailed analysis of that's a little beyond the scope of this presentation, but understand that any plan or benefit program that offers medical and surgical benefits and mental health and behavioral health benefits and substance abuse benefits, they have to be offered on an equal basis. It's obviously much more complex than that, but if there's a point solution program, especially it's providing mental health benefits and behavioral health, that's something that needs to be looked at carefully. And we have a very, very good detailed publication on that particular topic. On the next slide, we're going to repeat just to bring this home a little bit. You may be listening going, integration. It's really not that hard, but if you don't integrate, I'm going to remind you about some of these challenges, okay? If you keep that point solution out there, or that little regional carrier, to go back to that analogy, it's essentially operating on its own outside the infrastructure of the plan. That makes the point solution its own group health plan, and therefore it has to have all of the ERISA things, the plan documents, SPDs, 5500, has to have all of its own stuff. Sometimes, nobody on here, but out in the world, less sophisticated folks in terms of benefit rules and so forth, sometimes think, well, look, if we just don't call it a plan, if we don't create any documents or anything like that, then we don't have to worry about it, right? It's not an ERISA issue. That's sort of the ERISA equivalent of folks who say, you know, if we close our eyes, they can't see us. It's not true. A plan can just sort of exist by virtue of it being a plan, and all of those rules and requirements will attach to it. Thinking of that analogy further, that would be like telling our regional carrier, hey, it would be great for you to service our population, but you know, why don't you just go find a field somewhere around here big enough to land and take off your airplanes, and there you go. That may not be an airport in any sense that we would think about it, but it is a place where planes are landing and taking off and so forth, and obviously not compliant with the applicable rules. Again, integrate, attach the already existing plan. Existing alone with these point solutions, if you don't, again, there's those violations of the ACA. These are huge. The ACA annual dollar limit prohibitions and preventive services requirements, but if you integrate it with a major medical plan, it comes into the fold, into the already compliant overall plan. We've mentioned HIPAA compliance challenges. Good heavens, HIPAA is very, very important and complex enough as it is with the existing infrastructure. Why would you want two? bring it into what already exists and attach it and adjust it there within the already existing system. COBRA challenges, if offered to the non-medical population. Remember, COBRA applies to group health plans, which is a very expansive definition. And if a point solution that qualifies as a group health plan is offered to everyone, not just those, for instance, who have enrolled in the group health plan, that's a separate COBRA offering. And COBRA is complex enough without having a misaligned coverages and offering COBRA to just people who were not part of the medical plan and so forth. So again, integration would be key. And if none of that sells, folks, this is a reminder, what do HR departments just dislike more than anything else? One-offs, whether it's having a payroll system, but for one little area of the company, we have to do a different way. You end up spending 80% of your time on 20% of the problem. Integrate, integrate, integrate. It solves so many of the problems. And for the very reason that these are wonderful little niche offerings, that's exactly why we want to bring it in and integrate instead of creating an entire new infrastructure for a small niche, but very valuable benefit. With those federal laws, we're going to turn to another federal law in a different way, and that is the Health Savings Account law, part of a tax code, of course. And that is the potential impact on HSA eligibility that these point solution programs and programs like that can have. I'm going to go to the next slide.
Yeah, thanks. Really quickly.
Oh, sure.
Roger, just wanted to mention these last slides you've gone through on the integration and what happens if you don't integrate. One reason this is so important to consider is that oftentimes these vendors are not raising these issues as they bring them to clients, right? And we generally, our account teams are pretty well versed on this and can raise those concerns as they're bringing them. But just generally speaking, sometimes our consultants are not on the front lines when these programs are being brought in. And so that's one reason that this is so important, and to understand, what happens if you are not considering these laws and the challenges that that can raise. And as much as we love these vendors, again, they are bringing such a great product almost all the time to you as the employer, and such great benefit to the employees. But just that one more step when we talk about compliance is really the sort of the final screw in the product to make sure that it really is what you want it to be with your overall benefit plan strategy. So let's move on to HSA eligibility, because this is such a big deal too, right? And again, unknowingly, employers can plug in these programs and not realize that there's an impact for those that might be contributing to their HSA, or if the employer's offering the high deductible plan with the HSA combo.
That's
Sorry.
excellent. Oh, no, absolutely. That's excellent. Those are excellent points. Yeah, I appreciate it. There's a lot of kind of moving parts, and these products, generally speaking, are just terrific, and they appeal to folks who have the needs, and they give rise to some of these issues. And as we talked about, the federal laws that Chase just talked about have a basic analysis, and that's essentially, is this program a plan, health plan, group health plan, subject to any, some, or usually all of those things? That's sort of the analysis we just talked about. For HSAs and HSA eligibility, it's a different analysis. We're taking a different take on it. Essentially, is the program, would it qualify, be impermissible coverage, as it's called, under the HSA eligibility rules? So we're all pretty familiar with the HSA eligibility rules, at least on a high level, and on a very, very high level, it's two parts. First of all, you have to be covered by a high deductible health plan, HDHP, to be eligible for an HSA, which of course means being able to make contributions to an HSA. And number two, you cannot be covered by any non-HDHP coverage. That's sometimes the part that occasionally people who aren't too familiar with HSAs sometimes forget or overlook. These programs may qualify as impermissible coverage, even though they serve a particular niche. So what's impermissible coverage? Well, coverage is impermissible coverage if it provides significant benefits in the nature of medical care or treatment before the statutory minimum HDHP deductible is met by the employee. All right. So a pretty simple example, you have a point solution program, it provides a significant medical benefit, free and or at no cost to an employee. Well, that would be impermissible coverage. So of course, the $64,000 question is, what is significant in terms of benefits? Generally speaking, that's kind of a facts and circumstances determination. There's not a lot of helpful examples that comes out of the guidance and so forth. It's a very broad sort of thing. There is no sort of very bright line rule on that. But if it is significant coverage and it provides significant benefits, on a first dollar basis, as I might call it, or below that deductible, then it will very likely render someone who is covered by it, where that coverage is provided or covered, ineligible for an HSA. I do want to, as an extra note, a while back, IRS has clarified that non-HDHP, what was called carve-out coverage, is also impermissible coverage. These little terms kind of means different things. In that particular context, it referred to language in the actual law, the actual HSA law, which read very literally would have seemed to indicate that if a limited amount of coverage or a point solution type of coverage covered something first dollar that the HDHP just didn't happen to. In the example that came up, it was prescriptions drugs. This was a few years ago, that would be okay. Well, the IRS came kind of closed the door on that and was very clear. Any coverage, whether that's first dollar, it's below the HDHP deductible, whether the HDHP is covering it or not, would be, as a general rule, impermissible coverage. So on the next slide, we will just talk about a few exceptions to this, and we're mostly familiar with these, right? And this is about HSA eligibility in general. We're sort of applying it to point solutions, but these are the rules in general. Preventive care falling it within the IRS safe harbor definition would not adversely affect HSA eligibility, and that includes, but it's not limited to, the list you see there. There's many more than these, but these are the main ones people think about: periodic health evaluations, prenatal, well child care, immunizations, tobacco cessation, obesity, weight loss, certain screening services, and so on. Also, what's called permitted coverage, and that's accident, AD&E coverage, disability, dental care, vision care, long-term care, will not generally adversely affect HSA eligibility. And then the big one everybody talked about and interested in, that is the telehealth exception. As things stand now, that exception is available through plan years beginning before January 1st, 2025. So if you are on a calendar year plan year, 2024 plan year, as things stand now, that will end at the end of the 2024 calendar plan year. But right now, employers can rely on this telehealth exception. And that it means that for a point solution, if all program benefits are received via telehealth, phone apps, video conference visits, and so forth, then that will not affect adversely HSA eligibility, even if it otherwise provides significant medical benefits. Remember, this is a product of the COVID-19 pandemic. It remains a temporary measure based upon all the information presently available. May that change later in the future this year? It might. We don't know. There's nothing really there. Nobody can predict. But as things stand, it's available only through plan years beginning before January 1st, 2025. And the last slide on HSAs, just to give you a rough overview of possible approaches. There's two, really. What I call the siloed approach, that's a more cautious approach. And that's essentially when you have point solutions that seem like they might be impermissible coverage, just offer program participation in them only to those employees enrolled in non-HDHPs or non-HSA qualified HDHPs. Essentially, to flip that around, if people are in HDHPs to be HSA eligible, they get kind of blocked off from participation in that program. Obviously, you have to have the relevant language regarding eligibility, amendments in the plan documents, and so forth. That's a cautious approach. The more what I call inclusive approach, which is a little more aggressive, is okay, these benefits are available to everyone in the overall plan, but those of you with an HDHP to remain HSA eligible, they will be charged fair market value, FNV, for the benefits, okay? Thing about that is IRS is not expressly approved of that approach. It's sort of implied with regard to a little bit of guidance in another set of circumstances. So it's sort of up in the air, but it does have a surface appeal. And but the other issues that arise are, what is FMV? Is it the over-the-counter cost? Is it a contracted rate that the insurer would have made, or a network, or some other way? Tough to say, but it is a more aggressive approach because, again, it has not been expressly approved of, and the details are murky to say the least. So we certainly recommend consulting with counsel if you're considering that inclusive or blended approach. Bottom line, employers with the high deductible health plans should definitely review impermissible coverage rules that are there when considering or already having point solution programs. And with that, I'm going to turn it back to Chase to talk about reporting and taxation.
Thanks, Roger. This is just such an important piece of it with the HSAs that we really appreciate you walking through the rules and the possible exceptions to the rules, and then some approaches here of how to deal with this. Again, with the goal to try and make the two programs or make these point solution programs play well with the HSAs, right? And the high deductible plans. So really appreciate that. Let's jump into the tax rules here. Taxation is always a challenge. Generally speaking, again, we're coming back to this term medical care and this exclusion from benefits, exclusion of the value that benefits are being provided from an employee's gross income. And so when we're saying exclusion, a tax exclusion generally means that amount, whatever it is not included in the employee's gross income for tax purposes. And so this is what most employers, most employees want. I should say all, because I think everybody loves a tax benefit. But really, you can only do that, right? You can only take advantage of this tax exclusion if it is for medical care. And so really, that comes back, again, pretty closely tracks what we talked about at the beginning of the call. If it's medical care, it means it's ERISA. That's sort of the challenging news. It's subject to these federal laws. And you got to figure out how to integrate or comply with those laws. But the good part is that also means that you get the tax advantages. And so, but you do need to look closely at what is the benefit being provided. One example we included here is fertility-related point solution program benefits. And the challenge we've seen here is while temporary egg storage expenses could be considered medical care, if they're to treat infertility and not elective long-term storage greater than 1 year is what we mean when we say long-term. That's not considered medical care. This is very specifically spelled out in IRS publication 502. So that's one example of a benefit that you might think would be medical care, but actually is not, and it's very specific in the IRS publication. So long-term egg storage expenses might be taxed is essentially what we're saying there. Another challenge here is that the employer, you guys may not know which employees are receiving the benefit. And again, this is part of the convenience of the program, is that employees can access it on their own and maybe utilizing the benefit on their own, but the employer may be unaware if it's a taxable benefit, whether that is being captured somewhere, that taxation. And then, again, the third bullet point there with the challenge is the employers are generally the responsible party in reporting employees' gross income. Usually you do that on the form W-2, and that's true even if you engage a payroll provider to help administer the payroll. That payroll provider doesn't generally take on that tax obligation to make sure you're reporting your employment taxes correctly and your employees' income taxes appropriately. So just that note that there's going to be some coordination here. Some of the solutions we've seen is for the program vendor to communicate the benefits back to the employer, and then the employer reports it on the form W-2, usually through the payroll provider again, but you just have communication going with the point solution program vendor and the employer. Or we've seen some vendors that are willing to issue a 1099 directly to the employee. Again, this is an issue if the benefit itself is not medical care, is not something that the employer can exclude from gross income. A lot of these benefits can be excluded because they are medical care. And so that's true of both the premium paid by the employer and the benefit itself coming through. Those are generally excludable, again, as long as the benefit is considered some type of medical care. So that's taxation. We always say here and caveat, work with your CPA, work with your payroll provider, work with tax counsel to get an exact solution in here. But hopefully these are some potential solutions that will help guide that discussion. But tax is always something that we're living on the edge with as far as how we can advise our clients, and definitely something you want to get right, because there's just so much liability there with IRS rules and reporting taxes correctly. As far as reporting requirements, you do have ACA Form W-2 reporting, ACA P-Corps fees. That's the one that we wish had gone away, but the Congress reinvented for another 10 years. For those two, first on the Form W-2 reporting, again, this is the informational reporting requirement. So we're not talking about taxation. This is just the dollar value that we call the aggregate reportable cost of employer-provided coverage. Our position generally on this is, regardless of whether that point solution program is medical care, which would be non-taxable, or non-medical care, which would be taxable, those benefits generally fall within the scope of reporting. So they would be included in that aggregate reportable cost under that ACA Form W-2 cost of coverage reporting requirement. For the P-Corps fee, this again comes back to, if the program provides medical care, those enrolled employees need to be included in the covered life headcount for that P-Corps fee annual reporting calculation. For fully insured plans, we included a special note here. Point solution programs that are structured as a reimbursement are similar to an HRA, which is considered a self-insured plan for which a P-Corps fee is due. So in the fully insured context, the carrier is paying the P-Corps fee, but we always include that caveat. If you've got an HRA, and again, some of these point solution programs are structured like an HRA, you now have a P-Corps fee due because it's considered a self-insured plan. There are some special counting rules there for HRAs. Generally, you don't have to count dependents. You just count those that are enrolled in the plan as employees. But just that general idea that you've got to think about P-Corps fee when it comes to these point solution programs. If you integrate, you may be able to combine the count, meaning you just count an individual once. But again, if we're talking about the eligibility, that's that common party theme that we see throughout here. If you expand eligibility beyond your medical care, a medical plan eligibility, you're going to be picking up an employee count here potentially for the P-Corps fee. For Form 5500, this is another reporting requirement. If ERISA applies, if the point solution program is providing medical care and is not integrated, the employer has to do a separate Form 5500. And we talked about this right up front. The Schedule A is generally not being provided by these vendors. There are some instructions on how to file when a carrier, or a vendor in this case, does not send a Schedule A. Essentially, you just say that on the report, but there's some very special, specific and specific, I guess, instructions on how to do that. So just be aware that those are in there, and that vendors are not generally providing Schedule A's. Again, a lot of these vendors are saying they're not an insured product. So that's the challenge there, and the gap that is a result of that challenge. A special note on prescription drug reporting. Again, we call this RxDC. That's data collection. Rx is the prescription. So this is the obligation for insured and self-insured group health plans that have prescription drug coverage to report. There are some specific exceptions for HRAs and FSAs, EAPs, that's the employee assistance programs, your fixed indemnity, hospital or disease-specific insurance, and then standalone dental vision plans. So it's possible you could fall into an exception with some of these point solution programs there. But the takeaway here is that if the point solution program offers that prescription drug coverage, which could be the case, right, with some of these programs telling or providing the drug itself, then the employer has to consider how to complete the RxDC reporting. Generally, the employer has the responsibility as the plan sponsor. Vendors, we have not seen a whole lot of vendors agreeing to complete this on their behalf. So think about that. The CMS, that's the Center for Medicare and Medicaid Services. their instructions. That's where the report here for the RxDC reporting is going. We included a screenshot. You can basically consider these point solution programs as carved out benefits. And so there's some very specific instructions on how to complete those reports. Again, those are not due till June, but something to consider and something to think about, and is a little unique when it comes to these point solution programs. So we wanted to call that out specifically. All right, for our key takeaways, and then we might have a few minutes here for a couple of questions that we've seen in the chat. But our key takeaways, and we've got hot, fresh takeaways here. I always think of take out dining, but a lot of people call it takeaway dining, right? So these are our takeaway dishes for today from today's call when it comes to point solution programs. First, confirm employee eligibility. And again, this is something where vendors generally are encouraging employers to enroll as many employees as possible, because again, they're trying to get benefits to as many employees as possible and help as many employees as possible. Also, probably trying to make more money, because the more that enroll, generally the more money they'll make. But taking that away, just the compliance issues that we've talked about, that if you do expand beyond your medical plan participant eligibility, the compliance challenges that arise when you do that. But wherever it is, confirm that, make sure it's clearly communicated, and make sure it's clearly outlined in the related plan documents. Integration is another key takeaway and theme here with the medical plan, the easiest way to achieve compliance. We talked about what does that mean. Great analogy with the airports and the smaller airlines, Roger, really helps us understand. Think about including those benefits in the plan documents as bringing them into the airport. You already have plan documents. Just adding these benefits in there is helpful. Considering the impact on HSA eligibility, the PCOR fee obligations, and the tax issues. Working closely with vendors regarding COBRA, especially W-2 reporting, Form 5500 if they're willing to provide a Schedule A, or at least information, but put on a Schedule A, and other administrative details. Our team has actually worked closely with a lot of these vendors and we've been able to raise awareness with them on the compliance obligations, and that in turn has helped with the discussions. And so working closely with the vendors, a lot of these vendors are willing to have that discussion. Hey, how do we structure this so we can include this as part of the COBRA offering without disrupting the administrative side too much? So working with the vendors, they're open to those discussions, or at least a lot of them are. And then outside counsel or your NFP consultant. Again, we pride ourselves on our compliance wherewithal and our ability to help our clients work through these compliance obligations through our consulting teams. And so with that, our last slide here is a screenshot of our NFP publication on this issue that covers all of the issues that we've covered today as a recap, and also as something that you can have in your hands to refresh yourself, because I know there was a lot that we talked about today. So with that, I know we're pretty close to the top of the hour. Were there any questions, team behind us, that would be worth discussing as sort of the last call here?
Thanks, Chase. Yeah, I mean, I think we had just a handful. I know there's a lot of information that people need to digest. I really think it's just that basic idea of really understanding when one of these solutions provides medical care. I think that's the big thing and kind of the big takeaway, because we haven't always, thought about that way, and the vendors not always present it in the best light sometimes. So I think just the takeaway that, yeah, employers need to understand that there may be more compliance obligations than they thought if medical care is being provided. And then we had a kind of a question, a comment about, the integration. I think we had some great slides about, why integrating these solutions into the health plan can be advantageous. And then just making sure that, yeah, that gets done and why it's important. But otherwise, I think it's just a lot of information to take away, and hopefully people will review that publication that you have on the screen right now and reach out to their consultants to get that if they need it.
Perfect. Yes. Thank you, Kelly. So with that, I think that sums it up. Thank you, everybody, for joining us today. We really appreciate the support, and we hope this has been helpful to you. With that, I'll flip it back over to you. And thanks, Roger. It's great being on this call with you. Always love presenting.
You as well. It was great.
Yeah, thank you. So we'll flip it back to you, Amber. Thank you so much.
Awesome. Thanks, Chase. Thank you, Roger and Chase, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you, everyone, for joining us, and have a great day.